Tonight's topic is about COVID and the vaccines. We have three presenters. Eve Dunkert, she works for the Department of Health. She is their communication media coordinator. We also have Karen Vastine. She works for the UVM Health Center, Health Network. Her role, she's responsible for planning, advertising, outreach, such as this event. It was their effort to put it on and helped make sure that it got out there. Our main presenter this evening, she herself is a physician. She specializes in infectious diseases. She's really good with COVID and vaccines. So we welcome Dr. Kristen Place.
Hi, everybody. I'm Karen Vastine, and Laura, thank you for that lovely introduction. It's so nice to have at least one community member participating in person, and we hope for those of you who are joining the video later that you know that those of us who are on this call are a resource to you. And if you should have any questions that don't get addressed on this video recording, that Laura can send us your questions and we're happy to share those answers with her. So today I just wanted to share that Eve and Kristen and I all work in healthcare. And so we are very pro-vaccine. We want as many people to get the vaccine as possible. But that said, the reason that we're having this session is because we want all Vermonters to be able to make a choice that works the best for themselves and their family. And so what we're going to do today is to give you as much information as we can regarding vaccines, and we hope that you'll ask questions as we go along. So I'm first going to turn the floor over to Eve Dunkert from VDH, and we're going to do a PowerPoint at the same time. But Jesse, if you have any questions before we get rolling, we're happy to take those, and otherwise I'll get the PowerPoint started.
Thank you, Karen. Yes, and I do want to echo, we do want to give all of the information. We're not trying to persuade anyone, although that is kind of our hope as healthcare professionals, since the vaccines have been effective. But we want to make sure to answer any questions, so we can feel free to reach out to us following this presentation as well with any questions, concerns, anything that might be on your mind. So I just wanted to go through a little bit and just introduce the additional supports that are making this call possible. So thank you to Karen and Dr. Pierce, and thank you to Laura for really making this session happen. Thank you to Sabrina and Sarah for interpreting for us today, and thank you to Vanessa for providing the live captioning. And we can go on to the next slide whenever you're ready, Karen. So as of last Thursday, so that was May 20th, there are no longer any eligibility, or there are no longer any residence requirements in the state of Vermont. So anybody who is 12 or older and happens to be in the state of Vermont can sign up for a vaccine. Anybody who is under the age of 18 will need their parents, their caregivers, their legal guardians to sign a consent form and complete a pre-screening information form if they don't attend with their parent, their caregiver, or their legal guardian in person. And so I can put those links into the chat, and we can also follow up with any links for anyone who is not on the live Zoom following this presentation as well. So those are in the chat, and we can move on to the next slide, please. And so the requirements have changed effective of May 14th. So regardless, it's important to remember that people with COVID-19 can spread the virus even if they don't have any symptoms. So wearing a mask protects both you and the people around you from getting or spreading COVID-19. However, we are encouraging folks to get vaccinated, because for folks who are fully vaccinated, meaning anybody whose 14 days have passed after their final shot, is not required to wear a mask or maintain a 6-foot distance from others. There are exceptions for this rule. So in schools, in healthcare settings, in long-term care facilities, correctional facilities, and on public transportation, there is still a requirement to wear a mask. Many businesses and municipalities are also choosing to continue to require mask wearing. And so, for example, the city of Burlington did decide to extend their mask mandate for indoor retail stores. And some stores across the state might decide on their own that they prefer to have their customers use masks in indoor shared spaces. We do recognize that some fully vaccinated people may continue to choose to wear a mask in public, as they might just feel more comfortable doing so at this time. And it might be out of respect for folks with compromised immune systems. It might be comfort in general. But when in doubt, especially if you've just received your second shot or you're not yet fully vaccinated, we do recommend following 2 out of the 3, practices that we've been recommending for almost a year now. So the masks on faces, the 6 feet spaces, and the outdoor places. So we also do recommend, as a good public health practice and a good practice in general, continuing to wash your hands and things like that. I will put into the chat, this is a frequently asked question that is constantly being updated. This one has to do with current mask guidance. And I'm also going to place into the chat a PDF document that shares more information on mask guidance as well, since we know that was a question. And I believe that is it for me. So thank you so much to everyone who's making this happen today.
So before we move on, were there any questions for Eve about the information that she just shared? Okay, well, we're going to move on to Kristen Pierce then. So you ready, Kristen?
Yes.
Okay, so I think we need to pin you, which is going to be amazing. I promise it won't hurt. At least if it does, only a little. Okay, so now everybody should be able to see you, and we're going to get back to the slide.
Great. Thanks, Karen. And again, thank you to everyone for inviting us all here today. We've been doing this as a group for several months now, but we had a little hiatus, so this feels kind of like getting the band back together, and it's really a privilege to be able to do this. So again, any questions, just feel free to ask at any time. I think that we all know there are 3 vaccines available in the US, 2 what are called M as in mother mRNA vaccines made by Pfizer and Moderna, and then an adenoviral vectored vaccine made by Johnson & Johnson, I think affectionately referred to as J&J. Globally, there are other vaccines available. One of the most prolific, or the vaccine that's been given in the most places, is probably the AstraZeneca vaccine, which is not yet available in the United States. And most folks probably know that the Moderna vaccine is the first dose and then the second dose in 4 weeks. And the Pfizer vaccine is 1 dose with the second dose in 3 weeks. And the Johnson & Johnson, or J&J vaccine, is 1 single dose once. We do know these vaccines are extremely effective, and we've been talking about this since November, December, and I think all you have to do is look at the incidence of COVID in the United States and look at when we started vaccinating people to see that they really, really do work. Some people have asked, can I get COVID from the vaccine? Is this a live vaccine? None of these vaccines are live vaccines. So just as a point of reference, a vaccine that's a live vaccine, so a virus that's just a little weakened, is something like the measles vaccine, the mumps vaccine, or another vaccine called yellow fever. The COVID vaccines are not live vaccines, so you cannot get COVID infection from the vaccine itself. Having said that, people do feel sometimes crummy after their vaccine. So generally it's after the second dose of either Pfizer or Moderna. And some people feel nothing, and some people have fevers and feel flu-like with muscle aches, body aches. And some people have had to take the day or day and a half off from work as a result of it. And Karen and Eve have both heard me say that no matter how bad the side effects might make you feel from the vaccine, it's a lot better than getting COVID. So another thing that we were worried about early on was allergic reactions. There was some concern initially that if you had a severe anaphylactic reaction to shellfish or a medication, that there was a risk with the Pfizer vaccine. We now know that that's not the case. And the only risk, really, the only people that we've seen severe allergic reactions to are people that maybe have an allergic reaction to a component of the Pfizer vaccine or Moderna vaccine. Having said that, we know that having a history of severe allergic reaction is not a reason to not get the vaccine. When we first started this, we were only vaccinating adults, and now we've started to vaccinate children, which is really exciting. And I think through the summer, we'll see the age band go down so that younger children will be vaccinated throughout the summer and early fall. We also have had a lot of questions about if I'm pregnant or breastfeeding, should I get the vaccine? And the answer is yes. We do know that women who are pregnant are at higher risk of complications from COVID, having severe disease or having complications with the baby and the pregnancy. So they are considered a high risk group, and it's recommended they receive the vaccine. And that women who are breastfeeding is also safe for them to receive the vaccine. Another question that comes up a lot, and I think this is more and more in the news, is what about the variants? There's different variants, and that's little changes in the COVID virus that might make it, in some instances, less susceptible to the vaccine, or that the vaccine may not work as well. We do know that all of the vaccines in current development work very well against what we're calling the prototype, so the original COVID strain, and that they all work very well against the first variant, which we were calling the British variant, but now we're using the numbers for all of these different strains. The other variants, we think that we know the vaccines offer protection against those variants, but we just don't know how strong that protection is. And we'll, I think, have more information as the summer kind of rolls on. But we do know that getting the vaccine will help protect against any of the variants. We just don't know how well. And I apologize, the camera's here and the slides I see are here, so I have to keep toggling back and forth, so I apologize. One of the things we thought we just mentioned, because there was concern early on about the speed at which these vaccines were developed, and we heard this a lot. It was just too quick, too rushed, too fast. And I'd just like to say that it's important to recognize that all of the normal safety steps that we would put in place for any vaccine or drug development were not skipped or rushed in the process. And there was just so much scientific person power and financial power across the globe to develop a vaccine for this, that really what we saw was unprecedented. But all along the way, the normal safety steps that were there were not rushed. And if anything, if you followed the news, as some of the vaccines were put on hold during their clinical trial, I think that speaks to how careful and how diligent we were being as a scientific community to make sure if there was any early concern or early safety signal that the study was stopped and investigated. And so I think that it's just really important to note that the normal safety net is still in place. And we thought we'd just briefly talk about what's called the EUA, which stands for Emergency Use Authorization, and why that's a little bit different than full FDA approval. And it's really about the timing of the manufacturing of the product. And all of these vaccines, Pfizer, Moderna, J&J, AstraZeneca, all went through phase 3 studies, just like they normally would for an FDA approved vaccine. I think, Karen, you have a slide that, yeah, so I think this is probably the most important. There are other differences, but the most important differences between an EUA and FDA full approval is that during phase 3 studies, so that is when the vaccine or the drug or the device is being tested in thousands of people. In the normal vaccine development process, the manufacturing of the vaccine on a large scale would not occur until after the phase 3 studies. In the situation where there's an EUA or an emergency use authorization, I have trouble saying that, I apologize. The manufacturing of the product, so the manufacturing of the vaccine on a large scale, occurs at the same time that the phase 3 studies are going on. And that's because as soon as all the safety information is known, they want to be able to distribute that vaccine for emergency use. And then the Johnson & Johnson vaccine came out a little bit later, at least came to the United States a little bit later, and was a 1-dose vaccine and is a little bit different in terms of the type of vaccine compared to Moderna and Pfizer. And I think for those of us watching the news at that time, they were sort of suggesting that the J&J vaccine was not as effective as Moderna and Pfizer. But what we've seen now and what we know now is that all 3 of the vaccines are very, very good at preventing hospitalization from COVID, severe disease from COVID, and death from COVID. So that's really what we want to see in any vaccine. So all 3 of the vaccines are great vaccines.
So could you two explain whether or not people need to still wear a mask after both a first dose if they get a 2-dose vaccine and the second dose? Can you walk us through that a little bit?
Or maybe I can take a try at this and then you can fill in anything I miss or correct me. Does that sound good?
Yes, I'm sure I won't have to correct you.
So if you have not gotten the vaccine yet, then the guidance is to remain masked, since folks who, could have COVID-19 might be asymptomatic or not have any symptoms expressing in their bodies at the time. If you got your first vaccine shot, and if you're getting a 2-dose vaccine, so the Moderna or the Pfizer, you want to wait until 14 days after your second shot to make sure that your body has time to learn how to protect itself from COVID-19. If you have gotten the Johnson & Johnson or the one and done, as some folks refer to it, then after that 14-day period after that one shot, that's when you would be able to ease up on masking, distancing, and those other things. Of course, if you go into a store or there's a place that you're going to that is still following masking guidance, then you would want to respect their guidelines as well.
And I 100% agree with Eve.
This is Laura. Will businesses require proof that we show proof of the vaccine?
Laura, did you say businesses? Is that?
Yes, businesses, schools, any public entities or areas, will they require proof?
That's such a great question. And right now, for example, in the hospital, if you want to come and visit your family member or your friend, you can only come if you're fully vaccinated, and you do have to have proof of vaccination. Right now, I can't think of any other place in Vermont where you need proof of vaccination, but it might be, as time rolls on, that there will be things for which you need to prove you've been vaccinated, like maybe to get on an airplane and travel out of state or to travel overseas. I don't know that for sure, but I could envision something like that for certain things.
Okay, I noticed people still feel anxious of seeing others without a mask? How can they address that feeling?
Yeah, I went into the first place. I went into the gym recently, and it says there's a sign that says if you're fully vaccinated, you don't have to wear a mask. And it was the strangest experience that I've had in a year and a half, which sounds crazy to say. But I do think it's important for us to continue masking following the governor's guidance, but that we also do have to trust in the vaccines at some point when more and more of us are vaccinated to believe that the vaccines work. And I think, as the mask mandate releases, we will see people that will continue to wear a mask because they do feel anxious, and that's okay. Eve, do you want to add anything to that?
So I would love to add something, but I want to quickly go back to the last question, because a lot of folks wonder, those vaccine cards that you get, either you get a 1 dose and you get your vaccine card, or you get a 2 dose and you have your vaccine card, and it has 2 different dates on it. It's important to hold on to that in case there are going to be requests, or if you do want to travel, and that is requested in the future. And as far as masks go, I think that everybody is going to have their that we associate masks with safety, and so everybody is going to have their own process, and want to just respect people's needs and wishes, but there is I think even if mask guidance is becoming not mandated but optional, or even suggested for unvaccinated folks in the future, it's going to become more of a personal decision rather than a mandated state guidance pretty soon, right? We're looking at July 4th as a target date. And so I would say, just because you always have the option to wear your mask if that makes you more comfortable, but it is, a sign that we're trying to get back to a semblance of life without masks, and life after COVID. So it is, I think, a really good question.
Okay, I have another question. Is it okay to laminate that card?
I think it's fine to laminate the card. And Eve brings up a really important point. And what I've been telling people is if you have a smartphone, to take a picture of your card, because if you're like me, you'll lose the card and never remember where it is, but you'll always have that picture on your phone. But it's fine to laminate.
Another thing I've heard is that if you go to Staples, they will shrink your card to the size of like your driver's license and laminate it. And then that way it can fit into your wallet. And then you can keep your original copy, just in a safe place in your home.
Nice to know. Okay, I am curious. One of the questions with the COVID vaccinations, will they become an annual vaccination that's needed?
Another really, really good question. And the answer is nebulous. Probably. It might be that you get your COVID vaccine and your flu vaccine at the same time every year. We just don't know that yet. We don't know how long the antibody protection from this current vaccine will last, but it might be that we do need to get annual vaccines.
And then a question came as well. I'm curious how people know if they've been affected by COVID. How would someone know I've gotten it or I haven't?
That, again, really good question. You could get antibody testing, meaning somebody could draw your blood to see if you have antibodies to COVID. We're not doing that routinely because even if you had COVID, it's still recommended that you get the vaccine. So some people, I've had lots of patients say, I think I had COVID because in March I had the worst flu-like symptoms I've ever had in my life. Maybe they had COVID or maybe they had something else. Right now, without doing antibody testing, we don't know. But again, there's no reason, there would be no reason to do that because even if you had COVID, getting the vaccine is still really important. I hope that answers that question.
Okay, a follow-up question to that then. If they've had the vaccination, can I still pass along COVID?
Really good question, Laura. So what we're trying to understand is we know the vaccines prevent people from getting very sick with COVID, dying from COVID, and getting hospitalized with COVID. Is there still a chance that someone could be vaccinated and have mild disease, not know they were infected, and maybe pass that on to somebody who is unvaccinated? It's entirely possible. We see that with the flu. We see that with other vaccines. Some of the vaccine developers, when they were doing their studies, looked for what we call asymptomatic shedding, meaning they could swab your nose, you might still have COVID, but you had no symptoms. Not all of the studies did that. So I think this next summer and fall is going to give us a lot more information on that.
Okay, suppose I have just had one shot and I didn't bother with the second dose. Am I still fine?
For the mRNA vaccines, which are 2 doses, you might be somewhat protected. So for Pfizer, for example, they estimated 1 dose provided maybe 50 to 60% protection. And for Moderna, maybe over 70. But we don't know how long. And so the second shot provides an increase in antibodies or an increase in protection and hopefully a longer period of protection. So the short answer, Laura, is yes, you might have some protection, but the 2-dose vaccines have 2 doses because they boost, they increase the protection and they increase the length of protection.
How much time are you permitted to wait between the 2 doses? I know in theory, it's either 4 weeks or 3 weeks, but if there is an extended amount of time between the 2 doses, what do you do?
So for example, in Canada, because their vaccine supply is much shorter than ours, they're giving people their mRNA vaccines, so Moderna or Pfizer, and telling people they have to wait at least 16 weeks before their second dose. And we do know that no matter when you get that second dose, it will provide additional protection. So ideally in that 3 to 4 week period. But for example, you broke your leg and you were in the hospital and your vaccine was delayed by 2 or 3 weeks. That's okay. You should still get your second dose of vaccine.
Wow. So here in the US, we're lucky that we have enough vaccines and we have the supplies to give all 3 kinds of vaccines to people.
I feel like we are, and we should all be really appreciative of that. I can say on a personal note, I have family in India, and it's a terrible situation. There's just not enough vaccine, and so many people are getting sick and dying. So I feel so fortunate that we're able to get our vaccines, and especially here in Vermont, where I think we've done a really good job at rolling out vaccines and rolling them out quickly. And I say I had nothing to do with it. So Eve can take credit, but I had nothing to do with it.
All right, I have one last question.
Mm-hmm.
Will COVID ever go away? Will we ever say goodbye to COVID?
Probably. It might be that it is like the flu and it changes a little bit every year. If you look at what we called the Spanish flu, right, in 1918 and 1919, that plagued the world for 1.5 to 2 years. And then that disappeared until it reappeared in the 2000s, H1N1. So we might see that it's the same every year, it's just a little different, maybe a little less, makes people a little less sick. Or it might be that we see it just go away for decades and it might come back. It's hard to predict. I would love it to go away though.
Thank you so much. I would love it to go away as well. Thank you so much for sharing your answers and information and details, your experience when it comes to COVID and the vaccines both. Really appreciate it. Thank you.
Thank you for inviting us.